New causes of viral central nervous system infections are constantly appearing, as evidenced by multiple outbreaks of cases of encephalitis in Southeast Asia caused by Nipah virus. Nipah virus is a newly recognized zoonotic virus, named after the location in Malaysia where it was first identified in 1999, and has caused significant outbreaks in Bangladesh and India. What is Nipah virus? Nipah virus is a member of the family Paramyxoviridae, genus Henipavirus. It is a zoonotic virus. The animal host reservoir for Nipah virus is the fruit bat, also known as the flying fox. Infected fruit bats can spread the disease to human or other animals, such as pigs. Human can become infected if they have close contact with an infected animal or its body fluids, such as saliva or urine. This initial spread from an animal to a person is known as a spillover event. Once it spreads to human-to-human spread of Nipah virus can also occur. Transmission of Nipah virus. Nipah virus can spread to human from direct contact with infected animals, such as bats or pigs, or their body fluids, such as blood, urine or saliva. Consuming food products that have been contaminated by body fluids of infected animals, such as palm sap or fruit contaminated by an infected bat. Close contact with a person infected with Nipah virus or their body fluids, including nasal or respiratory droplets, urine, or blood. In the first known Nipah virus outbreak, humans were probably infected through close contact with infected pigs. The Nipah virus strain identified in that outbreak appeared to have been transmitted initially from bats to pigs, with subsequent spread within pig populations. Then humans who worked closely with infected pigs began falling ill. No person-to-person transmission was reported in that outbreak. However, person-to-person spread of Nipah virus is regularly reported in Bangladesh and India. This is most commonly seen in the families and caregivers of Nipah virus-infected patients and in healthcare settings. Signs and symptoms. Symptoms typically appear in 4 to 14 days following exposure to the virus. Symptoms may initially include one or several of the following: fever, headache, cough, sore throat, difficulty breathing, vomiting. Severe symptoms may follow, such as disorientation, drowsiness, or confusion, seizure, coma, brain swelling, encephalitis. Death may occur in 40–75% of cases. Long-term side effects in survivors of Nipah virus infection have been noted, including convulsions and personality changes. Infections that lead to symptoms and sometimes death much later after exposure, known as dormant or latent infections, have also been reported months and even years after exposure. Diagnosis of Nipah virus. Nipah virus infection can be diagnosed during illness or after recovery. Different tests are available to diagnose Nipah virus infection. During early stages of the illness, using real-time polymerase chain reaction, RT-PCR, from throat and nasal swabs, cerebrospinal fluid, urine, and blood. Later in the course of illness and after recovery, testing for antibodies is conducted using an enzyme-linked immunosorbent assay, ELISA. Early diagnosis of Nipah virus infection can be challenging due to the non-specific early symptoms of the illness. However, early detection and diagnosis are critical to increase chances of survival among infected individuals, to prevent transmission to other humans, and to manage outbreak response efforts. Treatment of Nipah. Currently, there are no licensed treatments available for Nipah virus infection. Treatment is limited to supportive care, including rest, hydration, and treatment of symptoms as they occur. There are, however, immunotherapeutic treatments, monoclonal antibody therapies, that are currently under development and evaluation for treatment of Nipah virus infections. One such monoclonal antibody, M102.4, has completed phase 1 clinical trials and has been used on a compassionate use basis. In addition, the antiviral treatment remdesivir has been effective in non-human primates when given as post-exposure prophylaxis and may be complementary to immunotherapeutic treatments. Prevention of Nipah virus. In areas where Nipah virus outbreaks have occurred, humans should practice hand washing regularly with soap and water. Avoid contact with sick bats or pigs. Avoid areas where bats are known to roost. Avoid eating or drinking products that could be contaminated by bats, such as raw date palm sap, raw fruit, or fruit that is found on the ground. Avoid contact with the blood or body fluids of any person known to be infected with Nipah virus because Nipah virus can be spread from person to person. Standard infection control practices and proper barrier nursing techniques are important in preventing hospital-acquired infections, nosocomial transmission, in settings where a patient has confirmed or suspected Nipah virus infection.